Another night, up with your child coughing. Are they glued to you like a koala, with a nose like a tap, and you're just running on snacks and vapor rub fumes? I've been there. I am Dr. Sophie GP, a doctor and a mum of 3. And in this video, I'm going to help you figure out when it's safe to stay home with your little one and when it's time to get some help. Because knowing what to look out for can take you from panic Googling at 2 a.m. to actually feeling in control. Okay, let's get the scary stuff out the way first, covering off what we call the red flags. So if your children has any of these symptoms, then they probably need urgent medical attention. So please do think about calling 999 in the UK, 911 in the US, or heading down to your local emergency department. So if they are struggling to breathe, so you might see them sucking in at the ribs, flaring their nostrils if they're little babies, and breathing really fast. If they've got something called stridor, this is a harsh, squeaky noise when they're breathing, especially at rest. If they have blue or grey lips or very pale skin, cold hands and feet with a hot body, floppy, drowsy, or difficult to wake. If they have a fit or a seizure, a rash that doesn't fade when you press on it with a glass, severe pain anywhere, or just crying constantly and inconsolably. Just trust your instincts, and if they don't look right, then please get help. Okay, now that's out of the way, let's talk about coughs and colds and what is normal. So basically, kids get around 8 to 12 colds a year, especially if they're in nursery or school. You're not doing anything wrong, it's just their immune system learning the ropes. So most coughs and colds are caused by viruses. And once kids start mixing with other kids, they catch everything. They spread through sneezes, coughs, and ever sticky hands, don't they? So some children can feel like they've had a cold for months because they just get one infection after another, especially in the winter months. And if anyone smokes in the household, then they're more likely to catch more infections and will take longer to get better. So think about stopping smoking if you don't already. The first few days are usually the worst. Then things gradually improve. But actually the cough itself can hang around easily for 2 to 4 weeks after the other symptoms have gone, especially if your child has a sensitive airway or they tend to get a bit wheezy. So it's usually fine to stay home if they've got a mild cough or runny nose, even if they've got green snot. I'm going to come back to that. If they're still drinking, weeing and playing a bit, and they're mostly their usual self, even if they've got a temperature. So this is what you want to know. What can you do at home to help? So for most mild viral infections, coughs, colds, sore throats, ear infections, the home care we recommend is pretty similar. So think about what we in the UK call Calpol, which is paracetamol, or ibuprofen. In the US, you call it acetaminophen or Tylenol. This can help with pain or if they're just feeling grotty. Fluids, it's really important to avoid dehydration, especially if they do have a high temperature. So make sure they've got plenty of fluids. They often just want to keep sipping a lot rather than have a big drink. And rest. This is where screen time is allowed. Get Bluey on the TV and cuddles are encouraged. Saline nasal spray or drops can be great for those kind of crusty baby noses, especially before a feed. And if they have got a bit of a sore throat, then sometimes warm drinks help, sometimes cold drinks help. See what soothes them best. And if they are over the age of 1, then a bit of honey and lemon can be useful. Steam can be helpful for congestion and croupy cough, so pop them in a hot shower room. And some people like to try vitamin C or zinc. There's some early evidence that it could potentially shorten colds, but there's nothing magical, and we do need some more research. There are some things I'd say don't bother with. So cough syrups or decongestants if your child is under the age of 6. And actually, even if they're over 6, there's not really any good evidence they work. And unfortunately, those vapor rubs, not much evidence they work either. Herbal remedies or unproven supplements aren't really recommended. And antibiotics only if they've been specifically advised. So here's a really helpful tip I tell my patients that often people are surprised by. So the fever itself isn't dangerous. It's part of the immune system doing its job because the bugs do not like it hot. So if your child's got a high temperature, but they seem okay in themselves, then you don't need to bring that temperature down. It's probably doing a good thing. So you only need to give them medication if they're feeling uncomfortable or they're in pain. And actually, it's useful to give some medication before they're being reviewed by a doctor. Because if you can bring down the temperature, it brings down the heart rate and we can give a more thorough assessment of them. And here's a little myth buster. Contrary to popular belief, green or yellow mucus doesn't automatically mean a bacterial infection. It usually just means the immune system is doing its job, clearing out the dead cells and debris. Okay, so why do we avoid antibiotics for colds? Well, these infections are usually caused by viruses, and antibiotics only kill bacteria. And giving them when they're not needed can cause side effects like diarrhea or rashes, sometimes even worse than the kind of cold itself. It can also upset the gut bacteria and make the antibiotics less effective when we do need them for serious infections in the future. So trust me, if we're not prescribing them, it's not because we're being mean or we're trying to save money for the NHS, it's because we really don't think they'll help. Okay, so when should you check in with your GP? So if they've had a fever lasting more than 5 days, or if the cough is just dragging on past 3 weeks, if they're drinking less or not weeing as much, or if your gut says there's something not right, we like that parental instinct. Okay, croup, have you ever heard of that? It's 2 a.m, your toddler suddenly starts sounding like a barking seal. That could be croup. This is a viral infection that causes swelling around the voice box, most common in 1 to 3-year-olds. And in the UK now, even if it's mild croup, we give a single dose of a steroid called dexamethasone usually to help reduce the swelling. So you need to go to your doctor for that. At home, keep them calm because crying makes it worse. Sometimes cool air can help, and make sure you sit them upright. Okay, what about sore throat? Something I see a lot of as a GP. And you might have looked in their throat and thought, my goodness, it's like a horror film. Bright red throat with big tonsils. But most sore throats are viral and don't need antibiotics. And actually, another myth buster for you, white spots on the tonsils doesn't automatically mean strep or bacteria. So what can you do at home? Ice lollies, big win. But actually sometimes warm drinks can help as well. See which works best and get some throat spray from the pharmacy. They're often a bit more happy to eat and drink if they've had some numbing throat spray. But do call your GP if they've had a fever lasting more than 3 days, if they're struggling to swallow fluids, if it's getting worse after day 3, or if they're really unwell or in severe pain. We'll sometimes do a strep swab and we might prescribe antibiotics if we think it is a bacterial infection, like tonsillitis or scarlet fever. All right, what about ear infections? So earache is really common after a cold, and it's not always caused by a true ear infection. In fact, many children get earache from fluid or mucus trapped in the middle ear, which usually clears by itself in a few days. If your child has mild earache but is otherwise well, eating, playing, no high fever, then antibiotics are usually not needed. And most of the time they'll clear up on their own in a couple of days. We can often prescribe an ear drop with a local anaesthetic if they're really struggling with the pain. But if there's discharge from the ear, or if they're age under 2 with both ears effective, or if the symptoms just aren't settling, then bring them in and we will take a look. Okay, so my final thoughts. You've got this. You're not expected to be a doctor, but if you know the red flags and what can be managed at home, it takes a huge weight off. So if in doubt, always check. You're never wasting our time. I'm Dr. Sophie GP, here to help you understand your health and feel more in control. I'll see you next time.